Naturally, regrow receding gums at home, a step-by-step guide. Introduction. Receding gums, also known as gingival recession, is a common dental issue where the gum tissue surrounding the teeth pulls back, exposing more of the tooth or its root. This can lead to increased sensitivity, a higher risk of tooth decay, and even tooth loss if left untreated. While professional dental treatments are available, many people seek natural, home-based methods to regrow and maintain healthy gums. This detailed guide will provide step-by-step instructions on how to naturally regrow receding gums at home. Understanding gum recession. Gum recession can be caused by various factors, including periodontal disease, aggressive toothbrushing, poor oral hygiene, hormonal changes, tobacco use, grinding and clenching teeth, and genetic predisposition. It's crucial to address these underlying causes to effectively manage and prevent further gum recession. Step 1. Maintain excellent oral hygiene. The foundation of any effort to regrow receding gums is maintaining excellent oral hygiene. This involves 1. Brushing technique. Use a soft bristled toothbrush and gentle circular motions to clean your teeth twice a day. 1. Avoid aggressive brushing, which can further damage gum tissue. 2. Flossing. Floss daily to remove plaque and food particles between teeth and along the gum line. 3. Mouthwash. Use an antibacterial mouthwash to reduce plaque and bacteria. 3. Opt for a natural mouthwash free from alcohol and harsh chemicals. Step 2. Use natural remedies. Several natural remedies can promote gum health and potentially aid in regrowing receding gums. 1. Oil pulling. This ancient Ayurvedic practice involves swishing oil, typically coconut oil, in your mouth for 15-20 minutes daily. 1. Coconut oil has anti-inflammatory and antibacterial properties that can help reduce plaque and strengthen gums. 2. Aloe vera. Aloe vera has anti-inflammatory and healing properties. 2. Apply fresh aloe vera gel to your gums, leave it on for a few minutes, and then rinse your mouth. 2. Repeat this process twice daily. 3. Green tea. Drinking green tea can help reduce inflammation and promote healthy gums due to its antioxidant properties. 3. Try to drink at least 1 cup of green tea daily. 4. Salt water. Rinse. Rinsing your mouth with a saltwater solution can help reduce inflammation and kill bacteria. 4. Mix a teaspoon of salt in a cup of warm water and rinse your mouth twice daily. Step 3. Dietary adjustments. A balanced diet rich in essential nutrients can support gum health. 1. Vitamin C, essential for collagen production and gum health. 1. Include foods rich in vitamin C, such as citrus fruits, strawberries, bell peppers, and broccoli. 2. Omega-3. Fatty acids, known for their anti-inflammatory properties. 2. Include sources like fish, flax seeds, chia seeds, and walnuts in your diet. 3. Calcium, important for strong teeth and bones. 3. Include dairy products, leafy greens, and fortified foods in your diet. 4. Avoid sugary foods and drinks. Limit consumption of sugary foods and beverages that can contribute to plaque buildup and gum disease. Step 4. Herbal supplements. Certain herbal supplements can support gum health and potentially aid in regrowth. 1. Turmeric, known for its anti-inflammatory and antimicrobial properties. 1. Apply a turmeric paste, turmeric powder mixed with water, to your gums, leave it on for a few minutes, and then rinse your mouth. 1. Repeat daily. 2. Eucalyptus oil. Dilute a few drops of eucalyptus oil in water and use it as a mouthwash. 2. Eucalyptus oil has anti-inflammatory properties that can help soothe gums and reduce recession. 3. Neem, known for its antibacterial properties. 3. Use neem-based toothpaste or chew on neem leaves to help reduce plaque and promote gum health. Step 5. Massage your gums. Gum massage can increase blood circulation and promote healing. 1. Finger massage. Gently massage your gums with your fingers for a few minutes daily. 1. This can help stimulate blood flow and promote gum regeneration. 2. Essential oils. Use essential oils like peppermint or tea tree oil for gum massage. 2. Dilute a few drops of essential oil in a carrier oil, such as coconut oil, and gently massage your gums. Step 6. Stay hydrated. Proper hydration is essential for maintaining healthy gums. 1. Water. Drink plenty of water throughout the day to keep your mouth hydrated and help flush out bacteria and toxins. 2. Hydrating foods. Include hydrating foods in your diet, such as cucumbers, celery, and watermelon. Step 7. Avoid harmful habits. Certain habits can exacerbate gum recession and should be avoided. 1. Smoking. Tobacco use is a significant risk factor for gum disease and recession. 1. Quitting smoking can improve gum health and overall oral hygiene. 2. Teeth. Grinding. If you grind or clench your teeth, consider using a mouthguard to protect your teeth and gums, especially at night. Step 8. Regular dental checkups. While home remedies are beneficial, regular dental checkups are crucial for monitoring and maintaining gum health. 1. Professional cleanings. Regular dental cleanings can remove plaque and tartar that cannot be removed with brushing and flossing alone. 2. Early detection. Regular visits to your dentist can help detect early signs of gum disease and recession, allowing for timely intervention. Conclusion: regrowing receding gums naturally requires a multifaceted approach that includes excellent oral hygiene, natural remedies, dietary adjustments, herbal supplements, and avoiding harmful habits. While these steps can promote gum health and potentially aid in regrowing receding gums, it's essential to consult with a dental professional for personalized advice and treatment options. By taking proactive steps to care for your gums, you can achieve a healthier, more confident smile.